something which is very hot topic these days, which is the weight loss injections. Because we have seen
Definitely
some
not.
Instagram posts that you can buy the injection online from us. Don't do that. Always follow your doctor advice.
That's correct. Get them from the correct resources. Use it as prescribed. We heard a lot about the ozempic phase. Can you tell us a little bit about it?
Let's debunk some myths and try to understand exactly what's the science behind that. So,
Dr. Matteo Vigo is a leading plastic surgeon in Dubai with over 20 years of experience in breast augmentation and cosmetic surgeries.
He is also one of the first UAE licensed surgeons to perform Mia Femtech, a minimally invasive breast enhancement procedure that delivers natural results with minimal scarring in less than 15 minutes.
Dr. Matteo Vigo, where precision, expertise, and care come together to create life-changing transformations with natural, lasting results.
hello everyone and welcome back to Beauty Talks by Dr. Matteo Vigo. I'm here today with a special guest, my colleague and expert in family medicine, Dr. Karin. Welcome, Barbara.
Matteo, thank you for having me.
It's a pleasure. Please introduce yourself to my followers so they will know who are you and why I invited you here.
Thank you. So I'm a family medicine physician with over 20 years of experience in Dubai. Part of my job and my passion is taking care of people's health and making sure they're healthy along the way. Being it preventive care, managing chronic diseases, or taking care of the women's health. As part of my job and passions, I also have a certification in obesity management, so I know very well ways around a healthy lifestyle. I was obsessed in diving at the past, and I still am, so I took a course in the diving medicine as well, in case some of my patients decide to go for a deep sea adventures.
So we are not talking about breast implants into the diving. We know they're safe.
They are.
But we will dive in something different today. Something which is very hot topic these days, which is the weight loss injections.
Yes, they are very popular these days.
They are very popular. I think you have a lot of requests from our patients. And I send you a few patients for that.
Thank you.
Let's, debunk some myths and try to understand exactly what's the science behind that. So what are these injections? How do they work?
So these weight loss injections are blockers of the hormones that we release naturally. They are GLP-1 hormone agonists. GLP-1 hormone is a hormone that is naturally released by our body, and it helps regulating blood sugar levels, insulin levels, and our appetite. Okay.
So it's like having someone in the stomach saying that, don't sell more food, we are fine.
That is very much correct, yes.
Okay. So it's very interesting. And so you will be stopped by having cravings, by having the need to eat more food to feel full, right?
That's correct. It would make your stomach feel full sooner if you use those injections, and it would stop the cravings as well.
Okay, that's very, very interesting. So it's a good start for someone who maybe tried different diets in the past and they did not succeed, right?
It is a good start for someone who has very high body mass index, over 30, or someone with a body mass index 27 who has some chronic diseases. It's a good start together with a lifestyle, because lifestyle is always a cornerstone of the treatment of the weight loss. Yeah,
that's always what I said to my patient that comes from me for liposuction. I can do a perfect job. I can make you lose a lot of weight, but at the end of the day, if you don't stop your bad habits, so you don't train, you eat junk food, you will go back to your previous situation.
That is correct. Same is with the weight loss injections. They're a good tool, but they're not a magic wand.
Exactly. That's something that people need to understand. Let's go a little bit more into the science. So we said that it stopped the sense of hungriness, it give you this fullness effect. But what is the science behind it? How does it really work?
So GLP-1 inhibitors or receptor agonists, they kind of block the feeling of hunger by stopping the cravings. They are regulating the hormone of hunger called ghrelin. So by stopping that hormone, we don't have cravings and say we don't eat on the regular basis. Ghrelin is the hormone that is important for the cravings where we don't have inhibitions when you want the food right now. So GLP-1 agonists, they are stopping that hormone or blocking it. The second, or the first most important, but second as I'm mentioning it now, they make people feel fuller for longer. So they are delaying the gastric emptying. So patients eat less food and less frequently. So there is no snacks in between, or there are no large meals anymore.
So people who usually sit in the evening watching TV and usually eating whatever is in the freezer, they will not have this kind of need.
They might have a need, or it might cross their mind, but they will be very much easier to put that need away and to stop themselves from opening the fridge. So they are coming in the better control.
Okay, so it's like stopping the little monster in your head saying that eat.
Yeah, that's correct. You are kind of quieting it down.
Okay, yeah. That's very nice. So they don't only work into the symptoms, so the immediate hungriness effect or the craving effect, but also they work on a deeper level, also regulating the insulin, right?
Yes, they are actually helping to regulate blood sugar levels and the insulin levels. So in the long run, they're resetting the metabolism. So we can use energy more efficiently and therefore store less fat. So that's in the long run.
So it's like a metabolic reset.
It is complete metabolic reset, which takes time.
Of course.
It's more of a marathon, not a sprint.
Yeah, that's also another important thing. People think I do an injection and in 10 days I lost 20 kilos.
I wish, but it doesn't work that way.
Exactly. No. Also, it's not safe to lose so fast that amount of weight. So the journey is very important to be, step by step and to reach your goal in a proper way.
That's correct. People should have a very realistic expectations when it comes to these injections. They work slow. They are slowly resetting the metabolism. Patients should expect to lose 1 or 2 kilograms a month, not to have an overnight transformation. So it does take time for someone who needs to lose a substantial amount of weight. We are talking about 6 months to a year, even longer, depending on the weight loss that needs to be achieved.
Okay. So as far as I understand, also this medication came into the market like anti-diabetic medication, and then they discovered this, let's call it side effect, and then they develop some medication which are only for weight loss, right?
Yes, this medication came in as a treatment for the type 2 diabetes. Most of the patients who develop type 2 diabetes develop it together with obesity, increased weight if it's not obesity, and with some other chronic conditions like a high blood pressure, hyperlipidemia. So these medications came in very handy to help diabetic patients to lose weight and automatically control their condition and other chronic conditions that might be having in the same time. Of course, some of them have been rebranded for the weight loss, but in essence, they're all cousins to each other. So they are similar medication.
Yeah, so when you consult your doctor for this kind of medication, we can suggest which one is the best for you.
That's correct.
From your goal, from your actual situation, your chronic diseases that are behind your weight gain. And
correct.
This will help us to understand which one works better for you. Because I've seen some patients, they tried one of those. We don't mention names today because we all know which one they are. But they tried once, maybe didn't work, then they switched to another one, and then it might work a little bit better.
That is correct. And it all depends also whether the patients might be having metabolic syndrome, prediabetes or diabetes. In case of those chronic conditions, if they're underlying with the weight, it will take longer, and then we need to use a little bit more stronger medication to tackle the weight.
Okay, that's and let's also debunk some myths and misconceptions about this medication, because a lot of patients coming to me and said, oh yes, but I heard that when you stop the medication then you gain weight immediately afterwards. What is your opinion on that?
This is a very good question, and this is a question I get very often, or let's say on every consultation that we talk about the weight loss. I get this question about returning the weight after stopping the injections. So these injections are not a magic wand, as I mentioned. They have to be used together with a lifestyle. Healthy diet, exercise, they're actually the cornerstone of the treatment. If the patient use this time with the weight loss injections to change their life habits to something sustainable and to maintain their weight, the weight is not going to come back. However, if the patients slip back into the old habits, continue overeating or stop the exercising, of course, the weight is going to come back. There is no magic here. It doesn't melt away, and the weight doesn't stay off unless we try really hard to keep it at a healthy weight.
A kick to start something is not a permanent fix.
It is a very good kickstart, and it's a very good metabolic reset start. So it's a medication that I say it's a very gratifying for the patient and for the doctor to see the results and outcomes of it.
But also, I think it's not only a metabolic reset, but it's also a mental reset, because I can tell, I use it in the past because I had a problem in my shoulder. I could not train for a while. I was traveling a lot and I was eating, not healthy, because when you're on holiday, you try not to. And I gained a lot of weight a couple of years ago. So under the direction of Dr. Barbara, of course, we did some blood tests, we check, and we decided to go ahead with that. And what really made me think and how much stupid things I eat in a regular day, and it helped me to really reset completely my way of approaching the food. And nowadays I am really conscious about what I'm eating. If I want to have like the cheat day, I do it, but I keep much more track on what I'm eating. And of course, it's very important, the side part, which is the healthy lifestyle and the training. And, Dr. Barbara, she's absolutely a rock when she goes to training. She trains very hard almost every morning, and she's very healthy in this sense. So she's a perfect example and candidate. But what is important is really to combine the two things. Also, another thing to underline is that the weight loss sometimes, if it happens too fast, is not only involving the fat, but also the muscle. So what are your suggestions to keep the muscle active and healthy and not to lose completely the tone?
Again, we are coming here to the lifestyle. It is very correct. When we are using weight loss injections, the weight loss happens across all the tissues. So it's not only targeting the fat, even though people would like that happens, that they give themselves injections, fat melts away and they don't do anything. The suggestion is to eat very healthy diet, to make sure you have enough protein, because protein is the building block of our muscles, and to engage in the exercise. Because by exercising, by doing some weightlifting, which is a muscle resistant exercise, we are motivating our muscles to keep forming and rebuilding. So when we introduce lifestyle together with the injections, we melt the fat and then we build the muscle, so we have a good physique after that.
Exactly. So very important. And again, this is like teaching your body to use the resources with the food inside your body to be used in the right way.
That is correct.
Rather than, taking anything you eat and go straight to the fat. Your body will really understand and learn how to use these protein, carbohydrates, whatever, fat also, to go into the right direction and to correct. Keep your results.
Yes, that is all correct.
Good. So who can use this? You said already, the BMI over 30, over 27 chronic disease, but we have a lot of patients which are in the right BMI and they want to lose this 1-2 kilos.
I have few of those who would just come into the clinic and ask for the prescription. They want to lose 4 to 5 kilograms. They're in the correct BMI. And they would like to fit into a dress for a wedding or for some event. Unfortunately, or fortunately, better to say, this is not for these people. The injections are not meant to be used to shed a few pounds when you need it. They are intended to be used for the patients who have a chronic health complications due to their weight. So for the patients who have a body mass index 30 and above, that is classified as obesity, for those patients, they don't need to have any chronic condition. However, some of them do. And for those who have a chronic conditions like a diabetes or hypertension, hyperlipidemia, they should have a body mass index 27 or above, which puts them in the overweight classification of the obesity. So that is intended for people who have health problems, not the people who want to have a new dress.
Okay, so I said before that I use them. Okay, my BMI went up for this.
You use them to lose 20 kilograms, not 5 kilograms.
Exactly. So I ended up like 16, 17 kilos. So that's why it was indicating that moment. That's correct. I could not train at that point. So it's very important that we know that. And what is usually the protocol? So when a patient comes to you and wants to go down this road, what are the blood tests you're doing?
So it's very important to get in touch with your doctor. It's not intended that you go to the pharmacy and buy injections yourself and use them as you wish should be used.
Sorry, not even on Instagram, because we have seen some Instagram posts that you can buy the injection online from us. Don't do that. Always follow your doctor advice.
That's correct. Get them from the correct resources, from the correct pharmacies, and use it as prescribed. So first, patients should have some general checkup. We usually have a look in some blood tests. We are checking the thyroid, liver function test, kidney function test, blood sugar. We're actually making sure that the body works well and there are some severe metabolic abnormalities that in case we start the injections that can get worse. So these are the general things that we do. And we do regular follow-ups with the patients, regular check-ins, making sure that they stay on track as well with their diet, with their exercises. Some people are very, motivated at the beginning to start, but they slowly start to fall into their old habits a little bit down the line. Some patients notice that even if they cheat on the more regular basis, that they might be still losing weight. And this is something that we need to keep correcting along the way, because we don't want them to return on their old habits while they're on injections. We want them to use all this time to make a sustainable, new and healthy lifestyle.
And what is your thought about keeping using, because I know some patients, even when they finish their weight loss journey, so they reach their goal weight, they can keep using it like once a month. What is your idea about that?
I would say it's not ideal because in that case we are coming to something that is intermittent usage, and we are coming to the situation where they're using this injection to shed few kilograms, not to gain weight. So we are coming a little bit in the gray area with the using of the injections, and that's not the intent. Once they come to the weight loss journey, unless they use the injections for the managing of the diabetes, we are trying to take them off and to put patients again to the healthy lifestyle. That's
also, again, the good choices in your healthy lifestyle is not negotiable. So
it's never negotiable.
It's something that really will make a change in your life. You will feel much better, and it will give also some boost in the self-confidence, in the mindset. You wake up with more energy, with the willing to do things. If you're lazy and you just sit on your couch, of course, it's much more difficult to have this kind of boost of energy. Absolutely. What is the biggest misconception that you see in the patients? The speed of a weight loss that they ask for, is the amount of the kilos that they want to weight, or is again the magic wand that even eating and not training they will lose the weight? What is the biggest misconception?
Well, there are a few actually. The biggest one is that injection is that powerful tool which will do all the job, which is definitely not correct. And the second misconception is the speed of the weight loss. So if you do have a patient with metabolic syndrome or pre-diabetes, they can't expect to sail through the weight loss injections. Usual weight loss for people with a metabolic syndrome is 1 to 2 kilograms a month. So they might feel quite frustrated when they see 3 months down the line they lost 3 kilograms. But 10 months down the line, it will be 10 kilograms. 2 years later, it may be 20 kilograms. So more weight they lose, more the process goes, it will be easier to lose weight because we are reversing the metabolism as well. So it's resetting the metabolism. It might be very difficult at the beginning, but later on, as they gain more muscle, lose more fat, get less insulin resistance, they are going to lose weight a bit faster. Okay. So it's a marathon.
Yeah, exactly. And also I see some patients that they start maybe at the beginning because they reduce the appetite. They lose a few kilos the first couple of weeks, and there is a plateau. And then they're steady for maybe 1 or 2 weeks without losing any kilos. They got frustrated, but it's a process, a long process. And you need to understand that you need to do step by step.
Step by step, and it's also important to have a regular check-ins with the doctor because we monitor it based on the weight, based on the appetite, and we titrate the dose when necessary. So we increase the dose as we are going on this journey. So it's not one dose does all the job. And also it doesn't mean that each month we need to increase the dose. We are titrating at it depending on the result we are getting from the patient. So regular check-ins are extremely important. They are, as I said, good for the patient and gratifying. They're also very good for the doctor. So we see what is the progress and how to help further.
Yeah, exactly. Another question that I have, because I have some patients who started the journey and then they come to me looking for a solution for some fat is still there, maybe some loose skin that they have after the weight loss. And there is also some problems sometimes with the anesthesia, okay? Because I know that because they reduce the speed of emptying the stomach, it might be a little bit debating where you should stop before, start later. What is your suggestion related to a general anesthesia, for example?
So we know that the medication stays in the body for 5 to 6 days. So it's a weekly. Most of these injections are actually weekly injections. So if the patient is planning to have any general anesthesia, it is good to do it at the end of these 5 to 6 days, just before you are due for your next injections. In that regards, we are not going to have a lot of delayed gastric emptying for the next day. In terms of the general anesthesia, patients need to come fasting anyway. So they cannot come having a good breakfast or a very late heavy dinner. So in case they need to have a general anesthesia and they're still kind of midweek in their injection or when the medicine is the strongest in the body, we can advise them to have a very light dinner, let's say 12 hours before the anesthesia, so we are sure that the stomach is empty and there are no consequences of food coming up in the respiratory system. It's also important to know that some people do go for gastroscopies. It might not be your field, but we try to stop their injections around a week before the gastroscopy so that we don't find content of the dinner before while this diagnostic procedure is done.
Okay. And another important topic about this injection, what are the side effects? Because we didn't mention in detail. So what patients should expect when they're starting this, the short period side effect and the long-term side effects.
Everyone would experience some nausea. That's quite frequent and most often reported side effect by pretty much all of my patients. Some people tolerate it really, really well. Other people don't tolerate that nausea really well, and it might actually really prevent them from eating regular meals. The most important thing with starting the injections, and that helps with nausea as well, is to eat small regular meals. So if you skip your meals, and because obviously the feeling of hunger is a kind of blocked, you might have more nausea, fatigue, or lack of energy. Over time, that side effects do wean off. In general, of other side effects, there are some gastrointestinal discomfort. Some people do report some changes in the bowel habits, but these are very rare. Nausea is the biggest one, and that's the one that is on a way pretty easy to tackle as well. With the right approach, with the right food, on time, enough hydration, enough proteins, it works really well.
Okay. And in the long run, do you see, of course, these medications are quite new, so there are a lot of studies going on to prevent and to understand how they behave. But do you see any long-term side effects?
I didn't see a lot of long-term side effects. It's important to mention that if the people don't eat the correct food, or if the patient chooses to eat not very healthy food, we can find some deficiencies, micro-deficiencies especially. But this, again, we come back to the lifestyle, and that the food has to be healthy, wholesome, that we have proteins, carbohydrates, vegetables, fruits on the daily basis, because we don't want to develop any deficiencies. So in the long run, that can happen. And the one thing that a lot of patients mention, but it hasn't have anything to do with the injections, as far as I know, is a hair loss. So there is quite a lot of report of the hair loss with these injections. That comes, I would say, from the stress of the body, because weight loss is on a way on stress, and until the body kind of readjusts itself and retune into the new metabolic rate, hair loss can happen, but in most of the cases, it does correct itself. Okay. On the regular basis.
So we can say that, are these injections safe?
Yes, they are.
So they've been approved by
have been approved
FDA
by yes.
for many regulatory body. FDA is the most famous one.
If used correctly, if used under medical supervision, they are safe.
Okay. Yeah. Very good, very good. And it's important that this comes a lot with my specialty, because I do a lot of, weight loss, post-weight loss surgery. I do a lot of liposuction. I do body contouring. So it comes a lot in combination. So we work very closely together. She's my family medicine, by the way. I go to her when I have a problem. She really helps me with my patient to understand what is the situation, if my surgery can be, supported by this medication.
Yeah, that's a good point. I do have a question for you, Matteo, as well. We heard a lot about the Ozempic phase. Can you tell us a little bit about it?
Okay, this is my field now.
That is your field.
Because I treat then the consequences of this weight loss. As I said before, I do, patients who had a gastric bypass, so they lose maybe 60, 70 kilos. So I do surgeries to tackle the problem in the skin excess. But I treat patients with minimal weight loss, 10, 15 kilos. And one of the most common reported side effects that you didn't mention, but you take it now on the table, is the loss of fat in the face. It is something that the patient will address as a problem, because they think, okay, I lose weight, but also my beauty in the face, my youth in the face, and my healthy appearance. So it is very important, as you said before, number one, to eat a lot of protein, because the protein will keep the muscles. And we lose the fat in the face, but if the muscle is there, this muscle, which is the muscle of the face, keep its strength, you will keep your volume in the face. Then you need to drink a lot of water and supplements. Collagen and all these kind of things really help to keep the healthy skin and the healthy appearance.
Does it happen only on the face or also on the body?
Also on the body, of course, because the more kilos you lose, the more, it's like a balloon. I always make the example to my patient about the balloon. If you inflate a balloon and you are obese for a certain period of time, and then you deflate, the plastic of the balloon, the rubber of the balloon becomes wrinkly, becomes loose. And that is normal. The more you stretch, and the more you do the yo-yo effect. So you lose, you gain, you lose, you gain, then your skin will not follow you. And it depends also on the age, because if you're 20, maybe your skin follows. And also the skin type. We have, darker patient. We are, in the Middle East region, so the skin is a bit dark for our patients, and they might have more stretch marks, which means less elasticity of the skin. And then we can tackle also this with some other interventions.
So what you are saying is that what you notice is that people lose 20 kilograms, but they also lose 20 years when they lose so much weight.
If they don't use their lifestyle tricks that we are giving them, it might happen. So it's very important to, again, follow your doctors. I think we have covered most of the topics. There will be a lot of questions after this podcast, so please write them down, subscribe to my channel, and put a like to this video. We will be sharing this on other social media just to spread the news about that. And of course, if you have any concern about this medication, go to Dr. Barbara.
Thank you.
You can find her online, and she absolutely will help you with this weight management. It was a pleasure. Thank you so much for coming.
Thank you for having me. It's always a pleasure.
If you like the episode, again, as I said, subscribe, follow, because new podcasts are coming, very interesting guests, and more news about all the world of beauty in Dubai and around the world. Stay tuned. Because you deserve the best.